Thanks for joining us today, everyone. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Shahab, Chief Medical Health Officer for the Ministry of Health. We have no SHA officials on the line today, and another reminder that any regional questions should be directed to the Saskatchewan Health Authority tomorrow morning when they make regional spokespeople available for those questions. Premier Moe will have an opening statement, followed by a statement from Dr. Shahab, and then we'll have about 25 minutes for questions. Premier Moe.
Well, thank you and good afternoon, everyone. And earlier today, the Saskatchewan Health Authority released the projections they have prepared and are using to plan for a potential surge of COVID-19 cases. And I want to take this opportunity to thank the Saskatchewan Health Authority for doing this work, very important work, and for what they are doing in preparing for what could potentially be a larger surge in hospitalizations here in Saskatchewan. At the same time, I'm encouraged by the actual case numbers that we have seen in recent days. Today, there are 11 new cases and 15 new recoveries. So active cases are down 4 to 165. 38% of our total positive cases have now recovered. The physical distancing measures that we are taking together are working. And so far, our case numbers and our hospitalization numbers have remained relatively low and somewhat manageable. So while the SHA continues to plan for a surge in cases and hospitalizations, as they should be, we have an opportunity to ensure that those projections do not become a reality in Saskatchewan if we continue to take the right steps. One area where we have been doing well, but we can do even better, is in the area of testing and contact tracing. Canada has one of the highest testing rates in the world, and Saskatchewan has one of the highest testing rates in Canada. But we can always do better, and we will. Yesterday, the Roy Romano Provincial Lab processed about 900 tests, the highest one-day total to date. And I have asked the Saskatchewan Health Authority to set a target of getting to 1,000 tests per day as soon as possible, and to try to get to 1,500 tests per day by the end of April, which will be dependent, of course, on being able to access the necessary testing supplies. We have already increased our contact tracing capacity, but we are making plans for further increases. The Saskatchewan Health Authority, for example, is working with the University of Saskatchewan College of Medicine to bring medical students on board to enhance our contact tracing efforts. In fact, some medical students are already performing this task. And medical students are ideally suited for doing contact tracing. If additional resources are needed, the Saskatchewan Health Authority will work with our 2 nursing schools to add even more contact tracing capacity. Ongoing testing and contact tracing will be key measures, not only to control the spread of COVID-19 today, but also will be key measures in the weeks ahead as we gradually get to a point where we could consider the potential of lifting some of our restrictions and potentially opening parts of our economy. But we are still several weeks away from even beginning that process. When does it start? When it does start, pardon me, it will occur slowly. It will occur incrementally. And it will occur thoughtfully and methodically. Continued testing and contact tracing will be key to determine whether we are controlling the spread as we begin to lift those restrictions. Finally, as I have done each and every other day, and I will continue to do each day that I have the opportunity, I want to say thank you to everyone in Saskatchewan for all you are doing to protect yourself, to protect your family, and to protect others in your community and in our province. You are making a difference. You are flattening the curve. You are reducing the spread. You are saving lives. So for that, I say thank you. Now I'll turn it over to Dr. Shahab.
Thank you, Premier. So I will go over some of the detailed numbers and some of the questions that we've been getting and my recommendations regarding that. So as you know today, 11 new confirmed cases, a total of 165 active cases, and 15 more people have recovered. So 103 have recovered, 38%. Of the 271 cases in the province, 119 are related to travel, 90 are community contacts, 16 have no identifiable exposure, and 46 are under investigation. It's notable that, as far as we can tell from the data we received, 26 of the cases are healthcare workers, but not all of them were exposed in the healthcare environment. 11 we know were exposed to a large event, but others would have been exposed either in the healthcare environment or in the community setting. But it's just a recognition that healthcare workers, other essential workers, put themselves at risk by providing essential services, and they obviously have to do everything they need to do to keep themselves safe, and we have to do everything as individuals to keep them safe in terms of how we access those services, whether it's accessing healthcare virtually when we can, calling ahead if we have to go, and also other areas such as shopping, which I talked to earlier. In terms of inpatients, we have 8 people in hospital in the province, 4 in Saskatoon, 1 in Regina, 1 in the north, and 2 people additionally in intensive care, 1 in Regina and 1 in Saskatoon. Of the 271 confirmed cases, 135 are in Saskatoon, 56 Regina, 51 north, 15 in the south, 10 from the central area, and 4 cases in the far north. 15 cases involved 19 years and under, 114 in the 20 to 44 age range, 94 in the 45 to 64 age range, and 48 in the 65 plus age range. 54% are males and 46% female, and our death rate currently remains at 3. As the Premier said, 15,621 tests have been done, second highest in Canada. I wanted to just spend a little time on some of the questions and we have been getting, and my recommendations for that. So as you know, April has many religious observances with Easter, Passover, and Ramadan now coming. It is important for me to reinforce some of my recommendations about that. It is very critical that we minimize face-to-face gatherings, whether at home or in other settings. It is really important that we continue to practice physical distancing over the next few days and weeks, and find ways of celebrating that we celebrate within our household, but then celebrate with others virtually. Anyone within the household practice appropriate processes to minimize exposure to people within our household. For shopping, as we prepare for the long weekend, it's important to go when there's less crowding. Just one person, if possible, goes from the household, have a prepared list, and be efficient when shopping, and be considerate of others who are shopping and of people who are at the till. And as we said, if you want to wear a cloth mask, that is certainly an option that you can choose to do. In terms of family gatherings, this is a time to observe them, but not to get together. Leaders in faith communities have been reaching out and developing many creative ways of celebrating religious events in a way that does not put members of that religious faith group at risk. And I think it's really important to follow their direction. The safest strategy to conduct services is through virtual means, and that will remain so for the next, that recommendation will remain so at least for the next few weeks. And this really is important for all of us to pull together by staying apart, but socially connected during the holidays. And finally, like the Premier said, we all saw the presentation by the Saskatchewan Health Authority on the modeling. And in addition to the Saskatchewan Health Authority, I just wanted to give my personal thank you to the epidemiologists, scientists, and modelers from Saskatchewan who did this really important work to inform where we are and where we could be in the future. But certainly that is something worth discussing in more detail over the next few days and weeks as well. Thank you.
Thanks very much. And we have about 25 minutes for questions. We'll take our first question from the line. Operator?
We have Murray Mandrick with the Leader Post.
Thank you, Mr. Premier. Can you address the skepticism that some of the modeling is creating, particularly among those who insist that this is tactical and that it's going to delay the needed reopening of the economy? There's a lot of concern coming from business types, perhaps, people saying that they're very worried that this modeling is a bit of a scare tactic by using numbers that are would be far in excess of what's currently happening in Italy, that would far exceed the rate in Ontario right now. Mr. Premier, what do you have to say to those people who are really anxious to see the economy restart and are skeptical of the numbers in a way in which maybe it could be counterproductive in the long run?
Well, I would say the strategy that the Saskatchewan Health Authority put forward here today with the modeling is a set of projections, not predictions, but projections, so that they can build our healthcare delivery model around these projections, so that we can prepare province-wide, and I think the people of this province expect us to prepare to deal with whatever is coming at us from a health delivery perspective. And this is important work that the Saskatchewan Health Authority has been doing. They're using these projections to ramp up, if you will, their healthcare delivery and from corner to corner in this province, and that is work that they should be doing, and that I think they have referred to as being the defensive strategy. The offensive strategy is likely what you're referring to, that has an impact on businesses here in the province, and that is the restrictions that we have put in place, the 10-plus people in a public gathering, the businesses that are allowed to stay open, as well as some critical public services. And there isn't a day goes by that I don't think about the impact that has on our economy. There also isn't a day that goes by that I don't think about the impact that this is having on the health and the fact that it's saving lives here in the province of Saskatchewan. So we are very much aware and in conversations with people across this province on ensuring that we have the health delivery resources in place. We have the restrictions in place that are ensuring that COVID-19 does not spread throughout our communities, and we're doing everything we can to keep families safe. But we are also doing everything we can, and you'll see more on this tomorrow, to support businesses and to support families and to support family incomes across this province as we take the first steps in a Sask First resource and recovery plan.
Do you have a follow-up, Murray?
Yeah, Mr. Premier, why do you suppose there's as much skepticism or perhaps lack of understanding towards the modeling? I'm wondering if it's because we've been in such a prolonged fight over things like the potential impact of global warming or other issues like GMOs and such that people have an automatic resistance to information like this. Is there some thought as to what you can tell people about why they shouldn't be as resistant to projection numbers as they are right now?
Well, the projections in this modeling are simply to ensure that we can plan for a healthcare delivery model here in the province that will address whatever we're going to be faced with in the weeks and months ahead. From the economic perspective, when we find ourselves on the backside of this curve, and I'm not certain when that will be, but when we do, you are already seeing a government that is engaging with the economic drivers in our province, and that is our export-based industries, to ensure that we will be able to build the Saskatchewan economy back to all that it has been and all that it can be. So we need to, we have said right from the beginning that our focus with dealing with the COVID-19 pandemic in Saskatchewan will be based on three main pillars. The first will be restrictions, which is part of our offensive strategy. The second will be providing resources both into our healthcare, our Saskatchewan Health Authority, so that they can deliver the services and be ready to deliver the services that we may have to. That's part of our defensive strategy. We're further going to be providing resources to our business community and to families so that they can financially survive this period of what is a low economic time, but ultimately be best poised to rebuild our economy and ultimately have an economic recovery here in the province. And we're focusing on all three of those items actively right now, and we'll continue to into the future.
We'll take our next question from the floor. Steph?
Mr. Premier, what will you need to see for you to begin to start lifting restrictions? What factors need to be in place? What specifics need to be there before you get the signal, okay, we are kind of safe to go ahead with this?
Well, first of all, with respect to the health restrictions, there will be many conversations that happen between Dr. Shahab and myself, the Minister of Health, others in government and in the Ministry of Health and the Saskatchewan Health Authority with where we are, if you will, on the curve. And I don't know exactly where that is and where we will peak today. We'll also be looking across the nation as looking to a number of provinces that, quite frankly, are further along in the curve than we are here in Saskatchewan. We look at British Columbia, we look at Quebec, even Ontario and Alberta seem to be farther into positive ID cases, if you will, and seem to be farther along on the curve than we are here in the province of Saskatchewan. In saying that, I would say that the efforts and the initiatives by the people of Saskatchewan in adhering to the restrictions that have been put forward by our Chief Medical Health Officer, we seem to be having some positive numbers the last few days in our efforts to flatten that curve. So I don't know what the parameters would be today on when we would begin to lift restrictions, but I do know that there would be many, many conversations that would determine when that point comes.
Do you have a follow-up, Steph?
Yeah, it's related to the target you've asked the SHA to set, about 1,000 tests being processed per day. Do we currently have the resources in terms of testing kits, supplies to be able to meet that demand?
My understanding is that we do today, and they go hand in hand, your testing numbers with the contact tracing. So as we find our way through the next number of days to ensure that if we have a regional breakout, if you will, and I think Dr. Shahab had indicated we had 11 come from one point of contact here just recently, that we're able to isolate that and disallow that from spreading into the broader community. That comes from having the testing capacity and having the contact tracing in place. We want to ensure we are doing everything we can to increase that capacity to the highest level possible, not only so that we can hold back the rate of a spread of COVID-19, broad-based spread, if you will, throughout communities and throughout the province. But we will need that capacity in place when we are fortunate enough to get to a point where we would be able to remove restrictions and ensure that we are able to monitor what that infection rate is doing with the removal of restrictions. It would be you remove a restriction and you watch and identify for a number of days and likely a couple of weeks. If the numbers stabilize, then you would have a conversation about maybe removing a further restriction, or unfortunately, if the numbers happen to rise, you would then bring a restriction back into place. It would be about attempting to manage as best as you could the infection rate in the province. Do you have anything to add to that, Doctor?
Yeah, no, I would agree with that, and just say that even when some restrictions are removed, it'll still be a different way of going back to business. Like we already see in essential services, although the work is continuing, how people behave in the workplace is very different, and they still maintain that physical distancing. They still minimize, sharing food and doing all the things that we do in terms of socially at home or in the workplace. So I think even if we remove some restrictions, how people behave will still be a bit different for the next little while.
That's a great point, and to some degree addresses Murray's question from earlier. Even if we are able to engage in opening up some portions of our economy at some point down the way, it'll be very different from where we were 2 months ago. When you go shopping, and we would encourage you to only go shopping as minimal times as possible with one person in your family, but when you go shopping today, it's a very different experience than it was a month ago. There is physical distancing that is being well respected in our grocery stores. There are plexiglass pieces up, separating the cashier, protecting the cashier from the customer, but also protecting the customer from the cashier. When we come home now, we wipe our groceries off with a Lysol wipe, which I did not do a couple of months ago. So things have changed. Even if we were able to at some point have the conversation about starting to remove some of our restrictions, it's understandable that there would be still many, many things that would be different from just a short while ago.
And we'll take our next question from the phone line, operator.
We have Alicia Bridges with CBC.
Hi, I'm looking at the modelling released today, and slide 13 shows trajectories for cases and deaths based on intervention. And the graph, the bottom axis, just says the word time with no actual timeline. And I mean, it seems that in order to come up with these models and to prepare, that you must have some sense of the time frame. Do you have any idea at all when the peak may happen? And if you do, why aren't you releasing it?
I would say I do not, but it would be sometime, my estimation would be sometime after a number of other provinces in Canada. Dr. Shahab?
So I think there's a couple of things that I think on a couple of slides where, for example, slide 7 and 8, where if you look at slide 7, our confirmed cases are still low and flat. So that's the reality. Slide 7 is showing the reality for Saskatchewan and currently in terms of total number of cases. And slide 8, I think, is important because that's showing our cases per capita. We know that our initial several dozen cases were mostly due to travel. But now that we have community transmission, those are the cases we need to watch. We no longer have mass gatherings. We no longer have travel. Those were contributing to most of the cases earlier. Now we have community transmission, in some cases due to doing essential work that you have to do, going shopping. And so we've been advising about how to further reduce that risk. But again, if you look at that, our rates are a bit higher in terms of rates per capita, but the curve is still flat. And on our website, you can see our cumulative cases, but our cases per day are still flat. So the modeling obviously gives us 3 projections. Scenario 1, which is quite significant. Scenario 2, which is kind of mid-range. Scenario 3, which is quite positive. And right now, actually, we want to be better than even scenario 3. And at this point, we seem to be better than scenario 3. But, as many speakers this morning, Dr. Susan Shaw and Scott Livingston and others said, we need to sustain that. And that needs a lot of commitment from us individually. It needs a lot of commitment from everyone who is providing essential services. And at some point, like the Premier said, some of that will have to be reviewed based on the evidence and feedback we're getting from testing and contact tracing, which will have to continue for several months. That where do you adjust? Where do you focus a bit more in terms of tightening up the transmission in a very specific way based on where the exposures are happening? And where can you cautiously relax some restrictions, but in a way that minimizes further transmission risk? So I think the modeling gives you some scenarios. We want to be as low as possible in terms of the modeling scenarios, and we want to constantly reevaluate based on the information we get from testing and contact tracing to readjust our recommendations.
Do you have a follow-up, Alicia?
I do. I have a report here from the Canadian Medical Association Journal. It was released today, and this does include projections, a projected week of the outbreak peak for Saskatchewan, starting the ranges between around late May until it would be early July, mid-July. So I'm wondering, do you have that information? Are you aware of it? Do you agree with that range? And also, we were told this morning that you don't have the data to come up with that at this point. If you don't have the data, how are they able to do this?
So maybe I can. So I have looked at, I'm aware of all those, many of those projections which are on publicly available websites that, for example, for the US and Canadian jurisdictions show projections based on data available today, aggregated from various sources, including Europe, which does show a peak towards May or May, June, July. And that's for many Canadian provinces as well as some US jurisdictions. Our modeling group out of the University of Saskatchewan and working with the Saskatchewan Health Authority has proposed projections that are more contextualized to the Saskatchewan environment, that really focuses on inputting data that we have already with our 200 or so cases, but also inputting data from other Canadian provinces and other parts of the world, but modeling in some of our strengths, which are obviously our ability to practice social distancing very effectively, which is shown in the daily case counts, but also showing some of our strengths around testing and contact tracing. And of course, having said that, we, of course, have not had outbreaks in long-term care facilities. That obviously changes case numbers and hospitalizations very dramatically. So there's many things that we don't want to see as much as we can, but obviously if events unfold in a way that there's clusters that are significant either in long-term care facilities or in communities, obviously that would need a more focused approach in that setting. but that would also change our assumptions. But I just want to say that, our hope is that we can meet or exceed scenario 3 and stay the course in terms of flat curve, even if some of the restrictions in terms of social and work activities are relaxed over the summer. But obviously the health system needs to be prepared for a worse trajectory that in some of the projections in Canada are showing based on European, US experiences. So the health system has to be prepared for the worst case scenario. We have to do everything we can to be on course as we are today for the best case scenario, and we have to constantly course correct in terms of what we have to do in terms of our own personal behavior, what we can do in terms of recommendations or orders around further restrictions or their easement, and what of course needs to be done around testing and contact tracing. So, it's a complex decision-making process, looking at what the modeling is suggesting and what our own data is showing us in real time. Thank you.
We'll take our next question from the floor. Arthur?
So just to kind of riff off of Murray's question, but to kind of throw it over to Dr. Shahab. Again, there does seem to be a lot of disbelief about the wide gulf here between the worst case models and the current data that we're seeing. And the worst case models do take into account that we continue the current measures. So can you explain to people how they should process those figures? I mean, is this something where as you look at the current data, I know you said you hope that it'll continue as it does, but as you look at the current data, are these scenarios realistic, kind of given the current measures?
So I think certainly if you look at the worst case scenario or the no intervention scenario, I think that was a reality if we had done nothing, 4 to 6 weeks ago. If we had just continued business as usual, right now we could have really been in the upslope of a very bad situation where the health system is not prepared and we are seeing a very catastrophic situation. So obviously, a lot of work was done, which included everyone in Saskatchewan, for the most part, really behaving very differently over the last 4 weeks. That has already changed that trajectory, and I think this is a good example of showing the power of each individual changing the course of an illness at an individual but aggregate level. So that's what's transpired over the last 4 to 6 weeks. We obviously want to continue doing what we need to do to keep the curve flat. But I think the trajectories, the scenarios 1 and 2, no intervention 1 and 2, are based on reality. They are not hypothetical models. They are based on the reality that has been seen by many countries in Europe and many states in the US. And so I think those projections are based on real scenarios that have unfolded, and I think that is something we have to keep in our back of our mind. But on the other hand, we also have seen success in countries that were several months ahead of us, especially in Southeast Asia, and we constantly are learning from them in terms of how they have recovered in the initial phase, how they're easing restrictions, showing some upsurge, and how they're controlling that. So I think in that sense, this really is something that we are learning from each other at a global level and will continue to do so.
And then this is a follow-up for the Premier. When we asked the SHA officials how we can track as close as possible to scenario 3, or even do better than scenario 3, they talked about additional measures that are being considered, but said that would obviously be for yourself and also Dr. Shahab to consider implementing. Can you describe now, having seen those potential cases, what additional restrictive measures you might be considering and when they may or may not be implemented?
We're not looking at additional measures immediately here right now with the numbers that we have. As we said, our numbers have been good for a few days here now, so we're not actively considering any additional measures. I would just say this is a little broader with respect, not to say that we wouldn't. And if we do have the potential of, for example, a community that would have a fairly significant outbreak in that community. And the question was asked here the other day is, why does Saskatoon have over double the numbers of Regina? because there's some gathering outbreaks likely that have happened in that area. Well, if it happened in a different community where we had a significant outbreak and that outbreak extended into some of our more vulnerable populations, if you will, like got into a couple of long-term care homes as well as an assisted living home, the health region, we don't know where that could occur, and it may occur. The health region, the health authority needs to be ready to address that wherever it may occur in the province, and that may be in this range. That's not to say that this may or may not occur province-wide, but it most certainly is quite possible to occur in regional areas of the province. We don't know where that is, so we need to be prepared province-wide for the modeling that is here, and the resources will be provided to the health authority to ensure that they can do just that. In saying that, there is something that the rest of us that can be doing, and that's on the offensive strategy and abiding by the restrictions that have been put in place. And I would say that Saskatchewan people have done that. They have accepted and embraced that better than I likely could have even imagined for the most part. Sure, there are a couple outliers, but for the most part, I see the people of this province greatly embracing Dr. Shahab's advice, and with respect to physical distancing, with respect to the size of gatherings that we have. And I firmly am beginning to believe that is why we are seeing the numbers that we are seeing here today in not only our rates of new cases, but the rates of cases that are coming off on the backside. So we're happy with that. And we'll continue as long as those numbers are able to continue. We are not actively considering further restrictions, and at this point, we're not actively considering removing any restrictions neither.
We'll take our next question from the line, operator.
We have Lisa Schick with CJME.
Hi, this question is for the Premier. I'm just looking for your reaction to this modeling. The SHA is planning for as many as 8,000 deaths in the province, so I'm just looking for what you think of that, your reaction to that.
Well, it's quite alarming. I was briefed on most of this modeling yesterday, the remainder of it this morning, and when you see, let me begin this way. I wake up each and every morning waiting for the numbers to come in and just praying that there isn't a death today. That's what I do every morning. So to have a model come out that indicates that over the next period of time there could be over 8,000 of deaths, that for me personally is tremendously alarming, and it strengthens my resolve to ensure that we need to continue to deal with this in exactly the way we have been in this province. That being said, the modeling that is put in place is for us to build our healthcare delivery over the next however long, so that we would be able to handle numbers like this that may potentially come into our healthcare system, and for maybe not province-wide, but may come in certain areas, certain regions, certain communities, and we need to be ready in each and every one of those communities to deal with what's coming at us. I've said that from day one. In saying all of that, and I said earlier, we all can be doing something to improve on these modeling numbers, understanding these are not predictions, they are projections. They are not predictions. And we can continue to do what we're doing, and I firmly believe that we can greatly change these numbers. We can greatly reduce the number of not only deaths, but the number of people that are admitted to hospital, and ultimately the number of people that contract this disease, to the point that not only can our healthcare system manage it, but also to the point that we buy ourselves some degree of time so that there are treatments that may become available, there are testing testing opportunities that may become available, and ultimately potentially vaccines that would become available. This is very similar to how we, just about a decade ago, worked our way through the H1N1 situation in Canada.
Do you have a follow-up, Lisa?
Yes, I believe Premier Kenny predicted unemployment in Alberta could hit 25%. Do we have any numbers what unemployment is looking like in Saskatchewan right now and how high it could get as the economy is kind of shut down?
I don't have numbers, but I would say that it's pretty grim with respect to the temporary and permanent layoffs that we're seeing in all sorts of industries across this province, and that would be the second thing that I think about every morning is the impact on the economy of what these past few weeks and likely the next number of weeks are going to have on our economy and how we are going to enter the recovery phase of the Saskatchewan economy. So in saying that, our economy in Saskatchewan, I would say we should be very thankful for the diversity that we have. We are, like Alberta and like other provinces, most other provinces, reliant on our export wealth. The industries like the energy industry, the agriculture industry has been the backbone of our economy for decades and will continue to be. The manufacturing industry, the mining industry, increasingly the tech industry. These are all industries that are building wealth in our communities and allowing other businesses essentially to operate in serving that export-generated wealth. It's a very diverse economy. It's been a strong economy for many years now, and we look forward to working with our economic leaders here to rebuild that economy and to enter what we hope will be a very robust recovery when we get on the backside of this curve.
And we'll take our next question from the line operator.
We have Dan Jones with NBC.
Yeah, good afternoon, Dr. Shahab. I've seen a letter come out of the northern village of Pine House from the mayor there that said that the fourth COVID case in the far north, that person actually tested positive in Saskatoon and has been living in Saskatoon for quite some time and is only connected to that community by a post office box. Can you confirm the location of that actual COVID case, and how do you guys determine the residency of a COVID case?
So I'm not familiar with the specific letter, and I would not comment on a specific case or a specific community. But in terms of the process, I think it's an area where the Saskatchewan Health Authority public health staff work very closely with public health staff and medical health officers in working for First Nations, Indigenous Services Canada, and Northern Intertribal Health Authority, as well as public health staff and medical health officers working in Northern Saskatchewan. So there's a process where once there's a test, that first of all, testing is available in 37 plus sites throughout Saskatchewan. It's integrated between First Nations, Northern communities, and the SHA. Once testing is recommended and done, the results are reported, and of course already there's information about where an individual sought testing, and then contact is made with the individual and to learn about additional contacts who are then contacted, whether they're in the same community or another community, because contact tracing asks who were you in close contact with over the last 14 days. So that work, I'm very proud to say, is working seamlessly across jurisdictions throughout the province, and a lot of credit for that goes to the Saskatchewan Health Authority, to Dr. Krzyzanowski, and all the medical health officers and public health staff. So from working in a very seamless way, we don't have any interjurisdictional boundaries in Saskatchewan. We haven't had that for other communicable diseases and other crises, and we certainly don't have that for COVID. So in that sense, while we encourage minimizing unnecessary travel within communities, if there are contacts across jurisdictions, they are managed in a very seamless and timely way.
Do you have a follow-up, Dan?
I do, yes. But doctor, to say that there's actually a case of COVID-19 in Pine House when that case is actually in Saskatoon, has no connection other than a post office box to that community, that would raise fears in that community that they have that virus when they actually don't, which would then bring on fears and more restrictions and whatnot. Doesn't that raise transparency levels of what the SHA and what yourself are trying to do, and at least letting communities know whether they actually have COVID-19 in that community and what community members can expect to do in the event they actually have it in their community?
Yeah, so, we've had this discussion before, and actually I had a very good session with Suma and Sarm yesterday as a webinar and a Q&A that's also, I think, going to be publicly posted that actually talks a lot about these things. And I think what we have to remember is that if an individual is self-isolating at home and had contacts either socially or at the workplace that are all accounted for, knowing where that individual is or which community is of absolutely no value because all the contacts are accounted for and followed up. And in that sense, the contact tracing is done. It's essential. People who need to know are made aware. If there's an outbreak where there's a need for public communication, that certainly is done. And that could include a certain community or a certain event or a certain setting. And that, of course, is done in a way that you obviously don't name the individual, but you say that there was transmission or risk of transmission if people went at this event or were at this setting. And again, in those kind of situations, there's a strong relationship and partnership with municipalities to get ahead of that and to make sure that if there's any further things that need to happen, either in terms of reaching out to people who are in isolation because they've been in as contacts and can't themselves go shopping or get their medications. The community and municipalities are involved in supporting people who need that care, but it's done in a way that you still respect the confidentiality of the case and, of course, all the contacts who are now in self-isolation.
We've got time for a last question from the floor. Steph?
Are you looking at asking members of the public to start wearing non-medical masks as a potential measure to kind of curb the spread as you look maybe down the road at kind of opening the economy and how that would work?
Right. No, at this point in time, we're not, asking people of the public, if you will, wholesale to wear masks. However, if wearing a mask provides anyone with a sense of comfort, they should most certainly do so. We have not had discussions with respect to if we were to get to a point where we could start to lift some of the restrictions. For instance, at some point in time, there's some people in this province that are going to like a haircut. And it's going to be difficult to respect the 2-meter distancing rule and still provide people with a haircut. So that, may be an example at some point in time where Dr. Shahab may say we need to cut some of the people's hair in this province, but in doing so, maybe it's most relevant to wear a mask in that instance. We've had very light discussions about those types of instances, but wholesale wearing of the masks here in the province, we have not been discussing making that mandatory. However, in saying that, if there are cases, and Dr. Shahab may have more to add, where I'm wearing a mask, where you're having difficulty respecting the 2-meter separation, the social distancing or the physical distancing measures as a whole, you most certainly, if wearing a mask gives you a level of comfort, you should do so.
Do you have a follow-up, Steph?
Yeah. In terms of the restrictions, what one would you like to see or would consider a priority in lifting when you think about the kind of economic impact some of these restrictions are having? What would kind of be the one that you would like to kind of tackle first?
I don't know which one exactly we would look at lifting if we were able to get there, but I would say this. I would hope it would be one that would have an absolute minimal, if any, impact on the numbers that are being reported and spread, and a maximum impact on opening up our opportunities for economic growth in this province. There are no illusions. I have no illusions that what we are doing isn't working. It is working, and it's saving lives, and that is paramount. B, I understand that it has an impact on our economy, and you are going to see the first steps of this government understanding that there needs to be resources and supports put in place to preserve businesses, to preserve jobs, and preserve our opportunity for fulsome recovery when we get on the backside of this curve tomorrow.
Thanks very much, everyone. That's all the time we have for today.